Hi y'all, my name is Lauren Watson. This is for my class 4502 Nursing Leadership and Management. Currently, I am a nurse at a family practice in Midland, and before that, I was a nurse. I was a dialysis nurse. So I've only been a nurse at the family practice unit for a few months now. It's definitely new and interesting. I get to see a lot of procedures. And then whenever I was a dialysis nurse, it was much more fast-paced. We didn't get to sit down very much and chart. That was all at the end of the day, and it's definitely a different world. I have been a nurse for 3 going on 4 years now. I started out with my LVN. I currently have my RN, and obviously now going for my BSN. And it's been an interesting ride. As far as leadership goes, in the current practice that I'm in, it's just 3 nurses to 3 providers. There's 1 doctor, 2 PAs. I'm a nurse for a PA. And so there's not really there's not a charge nurse or anything like that, but we do kind of just step in where it's needed, and we, help each other and make decisions. We help each other, just with anything. There's not really one person that is the charge nurse or that's in charge or anything like that. We kind of just help each other out, really. But whenever I was in the dialysis unit, I would technically charge, whenever my charge nurse was gone. There were 3 nurses there, and due to, just the way patients fall and everything during those shift changes, I would be, if I was the only nurse on the floor, then I was the only nurse on the floor and I was charging, and, I was in a comfortable position with that, and that's just kind of how that worked out. So that's really the only leadership that I've actually had in my nursing career. And then as far as things that I want to learn, I always want to learn about quality improvement in the facility that I'm in, because I think it's so important, and I think there's always room to grow. I think there's always new things to learn. I think we can always be better as nurses, always educate better, and just be better. I don't think that we can ever reach a point where there's no more room to grow, or there's nothing to learn or anything like that. So I'm really excited to kind of dive in, and especially in a family practice setting, because I feel like it's kind of, for me, it's more difficult to picture or to think of quality improvement, because, whenever you're in the hospital, you can think of medication errors and falls and things like that. And in family practice, there is the medication errors and things like that, but I just feel like it's on a lesser level than it is in the hospital setting. So I'm ready to kind of dive in and just see where we can improve in our clinic, because, like I said, I feel like there's always room for improvement. So hopefully we all have a good semester and finish this program out strong. So looking forward to finishing up, y'all. Bye.